This was a phase 1/2 study where we had patients not eligible for allogeneic stem cell transplantation, getting consolidation with dendritic cell vaccine, and the entrance entrance criteria for the trial were that they would have to be positive for Wilms tumor antigen 1 or PRAME, which were the antigens that were vaccinated or immunized against. So we produced dendritic cells for all of these patients, and we started vaccination once a week for 4 consecutive weeks, and then every month for a 2-year duration of the study, and the primary objective was to assess the safety and feasibility of the immunotherapy in this population, and we managed to produce dendritic cell vaccines for all the patients. Some of the patients needed 2 apheresis procedures to obtain enough product, and but we managed to produce for everyone. And for some patients, we actually had to wait a while after chemotherapy before they could mobilize enough monocytes into peripheral blood that could be harvested and made into dendritic cells. So if you look at the patient population, there are mainly good and intermediate risk patients, but 10% or two of the 20 patients were poor risk, but them being elderly and not eligible for stem cell transplant, and the median age was 59 years. So mainly in that population, good and intermediate risk, which did not proceed to allo transplant, and so the vaccine itself was very well tolerated. The immunotherapy was, without any serious side effects apart from the injection site reactions, as you would expect, and for 85% of these patients, we had at least the 20 doses that we needed, and for 15 of the 20 patients, we had the 1 apheresis procedure was sufficient to produce enough cells. And looking at the long-term results, we see that the patients relapsing had a higher mutational load in relapse, and 9 patients relapsed, and we had a long-term survival of 5-year survival of 80% in the below 60 years age group, and 70% in the patients above 60 years. The progression-free survival was a little bit lower, as could be expected, was 60% in the age group below 60 years, and 50 in the age group above 60 years of age. So this feasibility trial, we managed to conclude in the long-term effects. Certainly, provide rationale for pursuing this strategy further in larger trials, and which are now planned.